So let's get going. Our focus for today will be kidney stones. And if any of you have had a kidney stone, you are well aware. And for those who are not, it's a good thing to learn about. Certainly, a lot of our population is impacted by kidney stones, and and diet can really be a factor. So, really helpful to know some things that we can do. So, I'm going to go through kind of who gets kidney stones, what are they, the types of kidney stones, how do we diagnose these, various treatment options, and then what can we do to prevent kidney stones, whether it's prevention of kidney stones versus prevention of recurrence of kidney stones. So anybody can get a kidney stone. Generally, 20 to 40-year-old-ish is when it first will happen. Men are a bit more likely than women. And it turns out that Caucasians and non-Hispanic white people are more often affected than other ethnicities. The incidence of kidney stones is rising in the past decade. Statistics, depending where you're looking for these, as high as 1 in 11 will get a kidney stone. The economic cost of this in terms of medical treatment exceeds $5 billion annually. So it is, like most things in life, not insignificant, and especially when we're talking dollars here. So what are these things? I found a picture a little bit. Basically, these stones form in your kidneys, and it's basically a compilation of minerals and salts. And so they can be really ragged looking stones and sharp and jagged. They can be round. I think this is just kind of the old ball and chain kind of thing, but they can be all different colors, all different sizes. And interestingly, when they talk about sizes, they can be as small as grains of sand, which is then hard to see, or really large like marbles. I've read, I've never seen, and I'm not aware of somebody who's seen, but even as large as potentially a golf ball, which clearly would be a problem. The medical term for kidney stones is nephrolithiasis. And, basically there's all these different stones, and I will talk about these types of these, but knowing the makeup of the stone can help us really with prevention and recurrence. And so that's super important if we can get a stone and analyze it so we can learn what it's made of. So types of kidney stones. The most common type are calcium stones, and whether they be calcium oxalate, which is generally the most common, or calcium phosphate, you're looking at, those are 75 to 80% of kidney stones. Uric acid stones, somewhere probably around 10% of the stones. Those can be combined with or without calcium, and a lot of times due to acidic urine. We can find struvite stones. Generally, these are infection related. Ammonia that gets produced by particular bacteria binds with magnesium and phosphate and makes stones. And then there are also cystine stones, and those are more rare and generally associated with genetic disorders. So I'm not going to go real deep into those, that kind of stone, but we'll really kind of focus on kind of calcium oxalate, calcium phosphate, uric acid stones. Risk factors for stones, family history. It's not 100% penetrance, but a lot of times people will have the story, well, my mom had stones or my dad had stones or somebody. A huge risk factor for multiple things for all of us is dehydration. So water is so important. Diet, high in protein, high in sugar, and or salt increases risk factor for kidney stones. Obesity, being overweight, kidney disease, metabolic disorders, and I will go a little bit into that, and I think in a way that'll be understandable. And medications like diuretics, which could lead to more dehydration, that would be a possibility of a risk factor for kidney stones. Signs and symptoms of a kidney stone. Pain is one of those things. pain with urination, and or people will get basically flank pain, pain on your side, right up in your, your lower back ribs. It tends to come and go. It can radiate down into your groin, and that would kind of depend upon where we would find a stone. Um, and sometimes you won't have pain at all. I have made a diagnosis in a 20-some-year-old male that just had blood in his urine and no pain. So, but blood and urine is often a common finding, increased urinary frequency. Sometimes people have cloudy urine or urine with a weird smell, could be related to kidney stone. Certainly due to pain, you can get nausea, vomiting, sometimes a fever. It depends whether or not there's some obstruction. And certainly we worry if a stone gets lodged in your ureter, somewhere between that kidney and your bladder, then are we going to get an infection or even more fluid buildup around the kidney, different things like that. And so kidney stones don't always come with fever and don't always come with infection, but that is certainly something that we are watching for. Signs and symptoms will often correlate with the size of the stone and where the stone is, but not always. So to diagnose this, largely it's clinical. So if somebody comes in with the right story, if you will, we can kind of go, hey, that sounds like a kidney stone. We will often check a urinalysis. Sometimes we'll do labs, a CBC and a metabolic panel. Really important is imaging, whether we do an x-ray. A lot of times we do something called a KUB, which is kidney, ureters, bladder. And sometimes if we have a stone that will show up on an x-ray, we'll be able to see where a stone is. CT scans are used pretty commonly now. Ultrasound can be used. We used to do more IV pyelograms. Those can actually push a stone back up, and it's a dye study. But that is not used quite as often, at least in my experience now. But all of these things help us figure out the size of the stone, how many stones are we dealing with, where is the stone, and then are we seeing other anatomical issues with regards to this. If we're able to collect a stone, so if somebody has a kidney stone and it's deemed to be a size that you could pass it, we'll often have somebody strain their urine. So if we can get a stone or piece of stone, we can send that to the lab to have it analyzed, because then we'll know, is this a calcium oxalate stone? Is this a calcium phosphate stone? Is it a uric acid stone or a struvite stone? So we can get an idea of what kind of stone it is, which is really helpful. The other thing that can be really helpful, and reading this article that really kind of prompted me to talk about kidney stones today, really talked about a 24-hour urine. And I don't know that that has been done as often in the workup. And now reading an article and thinking about this, it makes perfect sense to me. Why has it not been standard part of this all the time? I have no idea, but it's really made me think, which is why I'm talking to you about it today. In terms of treatment, this is going to depend on the size, the type, and the location of the stone. If the stone's less than about 5 millimeters, there's a good chance it passes on its own. Not to say that it's not without pain, but it generally should pass if it's less than 5 millimeters. When we get into 5 millimeters to 9 to 10 millimeters, there's probably a 50% chance that this will pass. Once you get above 10 millimeters, it's a centimeter, you're really looking at some other intervention, because it's not likely that you're going to be able to pass that stone down through your ureter. A couple of different things that get used. Lithotripsy is done pretty commonly, and that's basically a shock wave. And so they'll use a laser. It breaks the stone up into smaller pieces, which you can then pass. A ureteroscopy, they basically insert a flexible scope into your ureter, so through your urethra, bladder, up into the ureter. Stones can be removed. Sometimes they are broken into pieces. Sometimes there's a stent placed. and they can actually even do, the same, like kind of a lithotripsy with that, to break it down if they need to. Kind of lastly, and definitely effective, is something called a percutaneous nephrolithotomy. And that's basically where they cut a little incision in your back and then go through with a scope into your kidney. And then they can go, whether the stone is in your kidney or it's just down in the ureter, they can grab the stone. That is really effective. But as you can imagine, when we're cutting through your skin, going through your back, going into the kidney, there's definitely more risk of injury to the kidney. And also, like, some of these other procedures require sedation and anesthetic, but if you end up in this more invasive procedure, you're talking about being in the hospital for a procedure, and that alone comes with its own risks as well, as you can imagine. So the fun stuff now is prevention, and this is what everybody who has a stone wants to know, is how not to get another stone. And for those of us who've never had a kidney stone, I've not had one, but having helped a lot of people with kidney stones over the years, I don't really want one either. So number one, avoid dehydration. So if your urine concentrates, you're going to concentrate all kinds of things, and that increases your likelihood of a stone. Losing weight, if you're overweight, obese, can be helpful. Limiting meat and animal protein can be helpful, and that has a lot to do with having acidic urine. Limiting salt, sodium, limiting sugar. Eat lots of fruits and vegetables, lots of fiber. And actually, interestingly, normal calcium intake, because people think that they should actually be maybe on a low calcium diet if they've had a calcium stone, but it turns out that that actually causes more calcium excretion and can make things worse. So having a normal calcium intake around 1,200 milligrams a day. Avoiding affections, obviously, for those struvite type stones, which are related to bacteria producing ammonia. And then clearly, if we're dealing with uric acid stones, we want to be able to make sure that we're reducing uric acid as well. So I'm going to show you a couple of different charts here that hopefully will make sense. But when we think about, what happens, and this is based on calcium oxalate stones, and this is the article that I shared in the newsletter. Basically, calcium and oxalate in saturated urine, if we have high urinary excretion of calcium, oxalate, and urate, these things are all going to promote stones. How do we avoid stones? Urinary volume. If we're excreting more citrate, potassium, and magnesium, that acts against this. So it really talks about how, fluid intake. If you reduce your fluid intake, it increases your urine saturation, which makes sense. Sodium intake, you increase that, you're going to increase your urinary calcium and reduce your citrate excretion. So you're increasing a promoter, decreasing an inhibitor. Calcium intake, if you reduce it, you're going to increase that urinary oxalate excretion. Meat intake, increase that, you're going to decrease your urine pH, increase that urine calcium, and reduce the citrate excretion. Fruit intake, if you reduce that, again, more acidic urine, you're going to reduce your citrate excretion. And then diet and content oxalate foods, which I'll talk about a bit more, if that's increased, it can obviously increase your urinary oxalate excretion. And so this I thought was really interesting, and this I don't expect everybody to understand, but this is what really made me think some more about the role of doing 24-hour urines. Of course, it's not super convenient to do. You get this big brown jug and you have to collect your pee for 24 hours. But what we can learn, is if we learn that you're excreting a lot of calcium, we know that, like, if we lower your animal protein intake, we lower salt intake, increased fruits and vegetables, that will help. If you're excreting a lot of oxalates in your urine, low oxalate diet, balance your calcium intake. If you have low citric acid or citrate in your urine, we know lowering animal protein, increasing that intake of fruits and vegetables, as well as potassium, citrate, and magnesium. If somebody has low urine pH, which is acidic urine, high uric acid, and basically uric acid that we see in the urine, increasing fruits and vegetables, potassium, citrate, and magnesium, lower the dietary purine intake. So that's our proteins, especially seafoods, because when we get into seafood, we can really get a high purine intake, really high. Like if you want to trigger gout or a problem with that, like I would say go out and maybe eat clams or oysters. That might trigger it for you. The other thing that will help with this is low animal protein intake. So it's really helpful to get 24-hour urines, and it's not something that I don't, at least in my practice, I haven't seen done a lot, and even in follow-up with urology patients, I've not seen it done a lot. So, and then talking a little bit about, foods with highest content of sodium. I think this is really helpful. I mean, I don't think that this is rocket science, but certainly smoked and cured canned meat, fish, salted beans, olives, canned food, cheeses, salted nuts, soy sauce, mustard, ketchup, some bread, crackers, those kind of things are high sodium content. Foods that are rich in oxalates, and this is really interesting for us here too. Rhubarb is really high, spinach, and so sometimes we think we're doing such a great job at adding more fruits and vegetables, and we need to be careful about what we put in. And I would say this really pertains to somebody who has an oxalate issue or has kidney stones, but it's something to be mindful. Beets, hibiscus, potatoes, beans, almonds, cocoa powder, and you can see some of these other grains. And the interesting thing is there's another article that I will reference when I send out the video. There's actually was an article written about lost seasonality and overconsumption of plants risking oxalate toxicity. And so it's really interesting because as we pursue, a more plant-based diet, being mindful of, which vegetables and what kind of nuts we're using. Because like now that people are like kind of avoiding dairy, people are getting like almonds and almond milk and all of these things. So is that part of what's increasing some of our kidney stones that we're seeing? There are certainly rhubarb, spinach, and those things usually we would think of seasonal, but a lot of times many of these things we eat year round now. And so that's kind of what this other article talked about. But some examples of like low oxalate greens that we have in abundance right now: arugula, bok choy, endive, cabbage is really great, lettuce, mustard greens, watercress. So there's lots of different things. So, I would say, especially if somebody has kidney stones, like having spinach be your go-to green probably is not ideal. And there's other things that we can use. So I think it's just interesting because sometimes doing the right thing and making the right choices in certain situations, especially if you have kidney stones or something, we just need to be mindful about what things that we're, adding in and using with the idea that we're improving health, which we probably are, but we still need to be careful about like kind of the oxalate concentration. The other thing that it talks about in the article that I'm referencing on the seasonality and overconsumption is certainly if people are over-consuming some of these high oxalate foods, sometimes people will just get muscle aches and fatigue. And so reading that has helped me kind of open my eyes to thinking about you know, inquiring more about specifics about diet, about vegetable intake, and maybe if you're an athlete and or your thing is walking every day, but like if you're having more fatigue, like really like how, I'd be curious, what if we cut back on spinach, cut back on almonds a little bit? Does that make a difference? So lots of different things to think about here, but just to give you a little bit of insight of the different things that I'm thinking about with all of this. I think it's just really cool, like some of the power and just knowing some of these things, we can make choices to balance things out a bit. So in summary, anybody can be impacted by kidney stones. Things we can all do avoid stones recurrence. Number one, avoid dehydration. Mediterranean or a vegetarian diet, so plant-based diet, limit meat and animal proteins, and optimize body weight. And with that, I've got a pretty good list of references. I'll share the other article in the next little newsletter that I send in follow-up. And thank you. These were just from last weekend up by Sheep Mountain.